It's Monday, May 11th, and we thank you for tuning in from throughout Newfoundland and Labrador and across the country. My name is Kathy Dix-Payton, Media Relations Manager with the Department of Health and Community Services, and I will be the moderator for the question and answer session. For today's event, we are joined at the table by Premier Dwight Ball, Dr. Janice Fitzgerald, Chief Medical Officer of Health. The Honorable John Hagee, Minister of Health and Community Services, is joining us via Skype from Gander. Please stand by. Our news conference will begin shortly.
Well, good afternoon, everyone, and welcome back. We will now immediately begin our update today by turning it over to our Chief Medical Officer, Dr. Janice Fitzgerald.
Thank you, Premier. Good afternoon, everyone. Thank you for joining us today, and welcome to Alert Level 4. Since the media advisory yesterday, we have no new positive cases. The total number of cases in our province remains at 261, with 243 of those cases in Eastern Health, 8 in Central Health, 4 in Western Health, and 6 in Labrador-Grenville Health. 52% of cases are female and 48% are male. And by age, we have 22 under the age of 20, 38 between 20 and 39, 39 between 40 and 49, 58 between 50 and 59, 57 between 60 and 69, and 47 who are 70 and above. 4 people are in hospital due to the virus, and of these patients, 2 are in intensive care. 244 people have now recovered, and we have tested in total 9,900 people. Today we are moving to Alert Level 4, the next phase of living with COVID-19 in our province. This has come to fruition because of the incredible perseverance and commitment that we have collectively demonstrated over the past 2 months. Thank you again for doing your part to protect your loved ones, yourself, and the most vulnerable of our society. While moving to the next level is indeed a positive thing, I can't emphasize enough the importance of proceeding with extreme caution as we gradually lift some of the public health measures in place. So some of the things you'll see, some of the measures you'll see lifted are related to gatherings, outdoor and recreational activities, healthcare services, and business operations. I should say relaxed, not lifted completely. It has taken us 2 months of significant sacrifice and discipline to reach this point, and we must not risk losing the gains we have worked so hard to achieve. I would like to clarify today that while gatherings for funerals, burials, and weddings are now expanded to 10 people, including the officiant, visitations and wakes remain prohibited. The expansion to 10 people does not mean individuals can now host backyard or dinner parties or large family gatherings. That time will come, but is not here yet. We have been also asked whether in-person meetings of up to 10 people, such as those held by community boards and town councils, may now reconvene. Given the availability of technology, meetings of this nature should continue to take place virtually for now, but this will be considered as we move through the phases of our provincial COVID-19 alert system. I would like to remind businesses and workplaces reopening today that this is not business as usual. Employers have a responsibility to ensure appropriate measures are in place, such as increased cleaning and ventilation in the workplace, ability for staff to maintain physical distancing, and work from home policies where possible. Employees have a responsibility to continue to practice the personal public health measures that have become so ingrained in our daily lives. This includes maintaining a safe physical distance from others, washing your hands frequently, covering coughs and sneezes, and staying home when you are unwell. Public health officials will be carefully monitoring each alert level to determine the pace at which restrictions can be relaxed or, if need be, strengthened. They will be looking at several factors, including the number of new cases of COVID-19, an increase in community transmission, and health system capacity to effectively treat a resurgence of cases, should that occur. And while our provincial public health system does its part to protect us, we each have an important responsibility as well. Please continue to follow the proven prevention practices that have played such a critical role in our success to date. Stay at home as much as possible. Shop online for essentials and use curbside pickup when available. Practice safe physical distancing of at least 2 arms lengths from others while in public spaces. And wear a non-medical mask or face covering when you are unable to maintain this distance. Wash your hands often and well. Stay home when you're feeling unwell and practice proper cough and sneeze etiquette. These simple but effective measures will dictate how we progress through the levels in our provincial COVID alert system. We are all very eager to move forward with our lives, and how quickly we do that depends on each of us. For more information about our provincial COVID-19 alert system and what it entails, please visit gov.nl.ca/COVID-19. This website also contains accurate and up-to-date information related to the public health orders currently in place in Newfoundland and Labrador, has frequently asked questions, and supports and resources for individuals, families, workplaces, and communities. I know the restriction of personal freedom we are all experiencing is difficult, and staying home for many of us who have been quite accustomed to a busy lifestyle has been quite an adjustment. To help support your physical and mental well-being, and as long as you are well and not required to self-isolate for any reason, I encourage you to get outside as much as you can to enjoy the outdoor activities while keeping a safe physical distance from others at all times. Activities such as walking, hiking, or bike riding can do wonders for our physical and mental health and can be enjoyed with members of your double bubble. Please remember that while municipal parks are now open, playground areas within these parks remain closed. This is for the health, safety, and protection of our children and families. As a recap, for those who may have just joined us, we have no new cases since yesterday's media advisory. The total number of cases in our province remains at 261. The breakdown by health region brings us to 243 cases in Eastern Health, 8 in Central Health, 4 in Western Health, and 6 in Labrador-Grenville Health. I'd like to take a minute to thank you today for all the well wishes I received over the weekend. I'm truly humbled by your kindness and grateful that we are able to support one another as we work together to get through this unprecedented time. As we officially turn the corner today and enter the next phase of COVID-19 in our province, I could not be more pleased with how hard we have worked to keep each other safe. Reaching this juncture has not been easy, but shows us that our selflessness and dedication has not been in vain, and standing together while physically apart is bringing us closer to better and brighter days ahead. Hold fast, Newfoundland and Labrador. Thank you.
Well, thank you, Dr. Fitzgerald, and good afternoon, everyone, and welcome to Alert Level 4. But we've also hit another small streak, that is 3 days with no new cases of COVID-19 in our province. So let's keep it going, especially as we now enter Alert Level 4. I know we often ask you to stay vigilant with our health guidelines, and the reason that we continue to say that is because it is extremely important. It's about supporting you in every way that we can as a province. It's about protecting you and your family during this crisis. We have to remember that moving to Alert Level 4 doesn't mean that we're in the clear. It's about gradually moving forward as we work towards what is our new normal. And that new normal means living with this virus. We cannot forget that the virus has the ability to move quickly from person to person. And we're seeing that in other jurisdictions around the world. So keep following the health guidelines and stay, as the Chief Medical Officer has just said, stay in your bubble. Do not entertain anything outside doubling the personal space that we often talk about. I know it's tough, but we must continue to adjust our lives. We saw many examples over the weekend of people being very creative and keeping a safe distance while celebrating Mother's Day. So let's keep up the great work. And as been mentioned already, our website has been extremely busy supplying you and supporting you with the most up-to-date and factual information pertaining to COVID-19 and the health guidelines. You can visit the website at COVID/19. That's where you will find the most up-to-date information, as I just said, including much anticipated questions around travel exemptions. And I know my office and we get quite a few requests and questions around travel exemptions. So now, if you believe that you qualify for an exemption to enter Newfoundland and Labrador, you can fill out the travel restrictions exemption request. That form is now available online. It's fillable online, and then you can send it back in. So just look under the tab Public Health Orders, and you'll find the exemption request form. Now, while you're there, under the tab Resources, you will find also a variety of supports for a number of areas, including individuals and businesses. Now, today, the federal government announced further supports for medium and large businesses. These are supports for businesses that have been affected by this virus. It is about protecting jobs and safeguarding our economy. They announced a new program today. It's called the Large Employer Emergency Financial Facility. It's a program that's open and available to large for-profit businesses, but also certain not-for-profit businesses such as airports who are struggling right now. And this is about the businesses that have an annual revenues of $300 million or more. But it's also there to support you while the federal government has been in another area for the medium-sized businesses, and that's the Business Credit Availability Program. So these are two new supports that the federal government has announced today. So for those mid-sized businesses, you'll see support there for loans up to $60 million and guarantees up to $80 million. So once again, for further information, you can go to our website under the tab Resources. And this was announced today, so more details will be coming out over the next day or two, and we'll be sharing the details and the specifics as they become available to us. So we also look forward to a new week as we kick off recognizing another group of people that we can count on every day in our lives. Within the last few months, we have come to rely on them, now more than ever. And of course, they are our nurses. Today marks the start of National Nursing Week, and I'm going to join the legions and thousands of people who are honoring them today. Anyone who has ever met a nurse, they know that they are indeed a special kind of person. We can talk about their professionalism, we can talk about their compassion, their caring, their skills, and their commitment. But this isn't new. Those are words that we use to describe nurses every day of the year, not just this one week. Now, in the midst of the pandemic, it is even more aware of the work that nurses do and the importance of it. While we often shelter in place, well, nurses, they go to work to protect us, not knowing what they'll face in the run of a day, let alone an hour. Actually, in a nursing life, things can change by the minute. The thing is, our nurses, well, they do what comes naturally to them as they go to work and they care for those who are sick and vulnerable. And then when they leave work, they go home to their families, their parents, their siblings, their spouses, and their children. Now, I've heard many stories of nurses who are physically distancing at home. They do this to protect their own families, but also to protect them from bringing this virus back into the work life. Nurses, as we know, have always made many personal sacrifices to care for us, and they are certainly doing that even more today as we deal with this pandemic. Some people say that it's trite to talk about medical professionals and using the terms like superheroes. Well, I can't think of a better word to describe our nursing professionals. So as you look around us, it could be your daughters, it could be our sons, their moms, dads, friends, neighbors who are nurses. We are proud of you. And so for everyone, reach out and send a thank you. They are truly the superheroes in our community. And think about it, was only just a few weeks ago that the World Health Organization also designated 2020 as the year of the nurse and the midwife in honor of the 200th anniversary of Florence Nightingale's birth. And of course, we all know how important she was to the nursing profession. So on behalf of all Newfoundlanders and Labradorians, once again, thank you, nurses, for your efforts, your strength, and the compassion that you provide. Now, in keeping with the topic of health, the need for blood is constant. So if you're healthy and you're able to provide the gift of life, think about contacting the Canadian Blood Services to book an appointment. They manage the national blood supply of blood products, and we know that in big events like weather, like holidays, tragedy sometimes happens, and the supply can be negatively impacted. Now, each and every one of us, well, we have a blood type. And just a few examples of what the supply would look like. If you're B negative, it would be a 5-day supply. And if you're O negative, well, there's a 7-day supply. So these are just a few examples of to let you know where we are today with our blood supply. And if you haven't thought of it before, perhaps now is a good time, because we are all in this together, so let's continue to support each other. So maybe donating blood is a way that you can contribute to your community and to the needs of this pandemic. So they also have information at the Canadian Blood Services about organ and tissue donations. And like many, the Canadian Blood Services, well, they are following the public health guidelines and have put measures in place to practice safe physical distancing. So as the saying goes, it's in you to give. So consider making an appointment. It's something that I know that I will be doing very soon. So let's continue to look out for one another. The time is now. What we do today, and especially what we do in the next 28 days, determines if the virus spreads tomorrow. We all have a role to play. So your actions and my actions will determine if we move into Alert 3. It would be disappointing to see this province have to move back to Alert Level 5. So let's take hold of it. Let's not allow this virus to take a hold of us. So once again, thank you, and I'll now pass it over to Minister Hagee for his comments for today.
Thank you very much, Premier. And indeed, again, no new cases, and Dr. Fitzgerald allowing us to move to level 4 is a good place to be. Just taking up the theme that the Premier mentioned about blood services and, if you like, the routine demands of healthcare. Certainly, there have always been regular healthcare issues that have continued through the COVID situation. And we've heard discussions back and to about how these can be and should be managed in the context of a crisis. And certainly, having to engage with physical distancing and to try and cut down on traffic in facilities, we've seen a shift in the way healthcare has been provided. We've had nearly 100,000 virtual consults across the province since we opened the door to that, allowing physicians and patients to connect directly with really whatever software they chose, and indeed even with the phone, should that be the only way for those of you who may have had challenges with internet access. This week marks a change in that the regional health authorities now will begin to look at how to bring back some level of planned services. They had kept going with emergencies, and they had kept going where possible with cancer-related surgeries, keen to reduce the occupancy of the beds in case of a surge that produced a strain on the healthcare system. The first wave certainly seems to have passed, and we have done very well as a province, both from the point of view of the way Newfoundlanders and Labradorians have heeded the advice of Dr. Fitzgerald and others, but also in the way the health system has adapted itself to cope. We need to continue to bear that in mind, because it will not be business as normal for the regional health authorities this week, or indeed when you move into alert level 3 once we get to that stage. This is a gradual ramping up. And we need always to have in mind that there will be a second wave, and the healthcare system has to be in a position to respond to that with really the potential for very little warning, and we need to work out what that should look like. So it will not, again, in the healthcare system, be business as normal for some considerable time yet. So alert level 4, a great step, and it's a first step. But I can detect already in the community in which I live, and I suspect St. John's is no different, a push, a momentum to move further and faster than perhaps the written word of the CMOH would allow for. But again, remember that whatever you're working towards, whatever normal you think is out there, will not be the normal that we had in January and February, and certainly won't be what we had last year. Even when we get to alert level 1, there are still constraints and restrictions on what we will be able to allow that will really not change until we either get a vaccine that works and is out there and widely used, or alternatively, or additionally, an effective specific treatment for this particular virus. The trouble we have in terms of making decisions about how fast to go is that this is a process. The incubation period of the disease, the time it takes to show itself clinically, is 14 days. And it is very difficult to make a plan and move very quickly when you know that what you do today will not show itself for 2 weeks. We did well with Easter, but it took us 2 weeks to find that out. We have now some changes in place. We have May 2 full weekend coming, and that is traditionally a time for Newfoundlanders and Labradorians to get together. And it's the getting together that will be problematic with this virus, because it only moves when we move, and it only spreads when we get together. And to be honest, we won't know how well we've done with May 24th weekend until early in June. We did well with Easter, and I think that's a testament to people taking this seriously and accepting that the world has changed. But the challenge now is, as the colours on the alert levels change, that we start to feel that we need to move quicker than we are at the moment. We need to pace ourselves, because if we run, we'll trip. and we don't need to do that. We've seen it happen in other jurisdictions. Ones we spoke about here weeks ago as examples of how we could get it right if we followed their lead. So South Korea, Singapore, Japan, they all did well, and they ran faster than they could, and they tripped. And we need to bear that in mind. And again, it goes back to what Dr. Fitzgerald has said so eloquently. We need to hold fast. So the key to all of this remains and will be for some months to come, the whole idea of physical distancing. We need to keep at least 6 feet, 2 meters, 1 fathom, whatever you use as an indicator apart. And where we can't, we know that there are benefits to wearing non-medical masks. And I've started to see these in my own community. So again, we need to protect ourselves and our bubble, even if that bubble has doubled. But we need to protect and respect the bubbles of other people too. So again, keep that in mind. And I think showing the resolve that we have over the last 2 months, we'll get through the next 2 months quicker if we do it slowly. Thank you very much, Premier, and I'll turn it back to yourself.
Thank you, Minister. And I think the message today from both the Chief Medical Officer and the Minister is that as Newfoundlanders and Labradorians, we must remain determined to follow the health guidelines, but we must also be patient as we work through this alert level 4 and hopefully into alert level 3. We can only do that with patience and determination. So I now turn it over to the media for today's questions.
Thank you, Premier. For the benefit of our speakers, we have 7 reporters registered for today's call. Each reporter will have the opportunity to ask 2 questions and 1 follow-up. We suggest that you not ask rumor-based questions. The purpose of these briefings is to address COVID-19 issues. All other government-related issues should be directed to the appropriate department or agency for response. Reporters will ask questions in the order they registered for today's call. Please do not press *1 until your name is called. Following this, should time permit, there will be an opportunity for single questions. This call will end at 2:59 p.m., and further questions can be emailed. Our first questions today are from Ben Murphy of VOCM News. Please go ahead.
Thank you. Dr. Fitzgerald, just wondering if there was an update on the source of the other case from last week.
The second case from last week, yeah, there was no source identified in that case.
Pardon? Sorry, I'd missed that.
There was no source identified in that case, no obvious source, but all contacts have been traced and tested, and everyone is negative surrounding, so we do feel like there has been good control with no transmission in that case, which is why we've allowed to go ahead with level 4.
Okay, thanks. And this is a bit more hypothetical, but with that protest over the weekend, let's say even one of those people test positive for COVID-19, how do you even begin to do contact tracing in a situation like this?
One of the people over the weekend, with regard to this last week's case, is that what you mean?
No, with that protest that happened over the weekend.
I'm sorry, I misunderstood.
Yeah.
Well, first of all, we start with close contacts, and we would identify whoever the close contacts are of any person who tested positive. Then, obviously, we would have to do some further investigations, find out who was at that protest, if there was a person there who was at the protest, who tested positive. We'd had to find out who was there, and that may involve us, we may actually be able to get that information if we engage with the people who organized it, and if not, we would have to put out some kind of notice that anyone who was there, we would ask them to self-isolate and to present themselves for follow-up to public health.
And it seems, for the most part at least, everyone there was wearing a mask, and this does clearly speak to a bigger issue at hand here if they felt the need to protest like this at this time. But the RNC have indicated that no charges have been laid. So I guess what does this kind of say to the general public looking at this defiance of public health measures and yet no real repercussions?
So I think
on the... Sorry, Janet.
No, that's fine. Go ahead.
I think on the issue of enforcement, we heard clearly last week and even earlier that the RNC and the RCMP felt that they needed some clarity provided by the legislature around what their abilities would be under the special measures orders. My understanding now is that having gone through that debate and the public debate, a very valid one about the balances between personal freedoms and public health greater good, having gone through that debate, I have not had any feedback from the RNC or RCMP or Justice and Public Safety that peace officers do not now have the tools they need to enforce the measures under the Public Health Act as it stands at the moment. So I can't speak to that. That's an operational issue.
Thanks.
Our next questions are from Peter Jackson of the Telegram. Please go ahead.
Hi. Is there any update you can provide with regards to testing on the patient that was moved back to ICU 9 days ago and precipitated the mass isolation of staff at the Health Science Center? Hello?
Hi. Okay. Sorry. I don't have an update on that patient's condition at the moment. And as far as I know, everybody who was around, or all the staff members that have been tested, none have tested positive to date, and none are unwell.
Okay. There are 5 provinces of Canada who've moved to their own opening. They have all 5 of them have allowed outdoor tennis under restrictions outlined by jointly across the country, including tennis. So why were those guidelines, which include exclusive use of balls, not acceptable in this province?
So certainly we've received some information from the Tennis Association, and we are looking at that, reviewing things as this week progresses.
Okay, thank you. And with regards to the fisheries dispute, Fingerball, is the government offering to intervene in any way in that situation?
So if there's a role for us to play as a government, we have resources that will be available to mediate, disputes such as this. But this is the process that we saw today, especially around the number of trips that would have been which was part of the discussion over the process that we saw this week. This was an agreement that would put in place by the producers, the seafood producers, but also with those are the fish processing plants, I should say. And then with the harvesters. And the idea, from what I've been told around this, is to make sure that as the seafood was landed, then it could be processed safely. So this, what we're seeing today is some discussions around, at the dispute or the protest, was around, discussions that would have been held between the harvesting sector and the processing sector. But if there's anything that we can actually do as a government to mediate and help them work through this process, yes, we're more than willing to be able to do that.
Thank you.
Our next questions are from Peter Cowan of CBC News. Please go ahead.
Question about the exemptions for Dr. Fitzgerald. You've talked about offering compassion. We talked to a woman who is originally from here, lives in Alberta. She was denied permission to come home after her mother died unexpectedly. She wanted to be able to come home, isolate for 14 days, and so the family could then have a small 10-person funeral. Why would that not qualify for an exemption?
So I can't speak to specific exemptions. I'm not evaluating every single one. As you can imagine, there have been many that have come in. Certainly there is an appeal process in place, so if somebody felt that they received a rejection and wanted to appeal, they could certainly do that. And that would be looked at with the same urgency.
Can you explain what is that appeal process? Who then would look over it and has the ability to change essentially the position on whether or not an exemption is granted? So
sometimes that means we need more information, or it may mean that a new information comes to light. So someone would just apply for an appeal through the exemption email and just indicate as such that they were appealing the decision. And then somebody would review it, and it would come up the chain then to be reviewed so that somebody in the office of the Chief Medical Officer of Health would have a look at it. Excuse me.
This is a question
Sorry.
for Minister Haggie. This question was asked last week, but we didn't really get a clear answer. The new measures introduced in Bill 38, are they constitutional, and why?
My advice from Justice and Public Safety and our own lawyers is that there is always a tension inherent in the Constitution between Section 1 and subsequent sections of the Constitution. The Supreme Court itself have referred to the whole Constitution Act as a living tree that is pruned and grows over time with good case law. So the view from JPS and ourselves, on advice from the law enforcement peace officers, was that they needed clarity around their role. That clarity was provided. It was debated in the House. At the end of the day, the tensions built into that, the way the Constitution and the Charter of Rights is framed, allows for rights to be abridged or reduced only to the extent that is necessary for the greater public good. Whether or not our actions meet that test would be a decision a court would take should someone choose to challenge it.
Our next questions are from Marie Isabelle Rochon of Radio Canada. Please go ahead.
Yes, hi. I was wondering, can people have their vacation at home this summer? So can residents of Newfoundland and Labrador go sightseeing and rent accommodations in other towns in Newfoundland?
So there's a program that's currently being developed now within the department responsible for tourism. And that department is looking at the options of promoting the whole idea of Newfoundlanders and Labradorians vacationing in their own province. Of course, right now we need to work with the public health officials like the Chief Medical Officer to make sure that we can actually do that safely. So if we follow the rules, we follow the health guidelines, we get to alert level 3 and beyond, is only then that we can able to make the safe decision of a travel amongst Newfoundland and Labrador. It is something that we're hopeful. We believe that vacationing in our province right now is good for mental health. It's good also for physical health, but we must make sure that the measures are in place so that we can do so safely.
Thank you. We learned today that the deficit of Ontario may jump from 20 billion to 40 billion because of the COVID-19 pandemic. I was wondering, when will the government of Newfoundland and Labrador will be able to give a fiscal and economic update of where the province stands?
Yeah, so we're working with the officials at the Department of Finance and, watching this as much as we can. It's certainly uncertain times. As I mentioned last week, these were, as you use Ontario as an example, this is a province that put a budget in place, and really, as I said last week, it's really not worth the paper that it's actually presented on, because the financial controls and the expenditures to actually support the economy and our healthcare system is right now is we continue to monitor, but we must be able to be in a position to respond. And as we look towards now working with our local businesses and our not-for-profit groups, what it will need from us as support from the provincial government, with the additional supports from the federal government, what we can actually do to support our economy. But yet we'll continue to monitor the financial position of the province, and when we're in a position to do so, we wanted to be able to give the people of our province an update as well.
Thank you. And my last question, when the time will come to reopen the province's borders, and considering that the rate of the spreading of the virus is not the same in every province, are you considering allowing entry to travelers from specific province, or are you going to allow travelers from any province at the same time?
Well, any decision that's made within travel from outside the province into Newfoundland and Labrador would be on the advice of the Chief Medical Officer, and I think we've outlined a number of the principles that we must have in place. The amount, the inventory of PPE is one example, making sure that we have the acute care beds available within our health system to be able to respond to a setback. And also we've been looking at the idea of what a national surveillance program would look like, so that we could actually help follow not just Newfoundlanders and Labradorians, but Canadians as they move from one province to another. This is a large part of the discussions that we have with the federal government now as we open up our provinces and yet open up the country. But we're nowhere near that discussion right now. As you've taken the wise advice from the Chief Medical Officer, moving to Alert 4 today is a long ways from opening up our province. This is very difficult for us as Newfoundlanders and Labradorians as well, as we know we have many families that live outside of our province. We know they were looking forward to a summer of coming back to Newfoundland and Labrador for a visit. Right now is not the appropriate time, but we'll continue to work with public health officials, and at some point when we're free to move around the country and free to allow people into Newfoundland and Labrador, we'll make sure we have the appropriate notice out there.
Our next questions are from Kellyanne Roberts of NTV News. Please go ahead.
Thank you. I'm wondering about fertility clinics and if there's any plans or assistance available for families who require fertility treatments such as IVF, which isn't available here in Newfoundland and Labrador.
Good question, Kellyanne. Fertility treatments are not an insured service under the Canada Health Act. What we have done is we supply support for the clinic in St. John's, which my understanding is it does pretty well everything except certain procedures which require volume and technical expertise that we simply don't have the critical mass in the province to do. The challenge, quite frankly, with that is the interactions that are required and ultimately the travel that would be necessary to complete fertility treatments just in the present environment. My understanding is that people who seek those services off the out of the province go either to Halifax, Toronto, or in actual fact into Alberta, where my understanding is currently the best results are obtained there. That is the issue of travel between the provinces, and in the current climate, I'm not sure that there's a public health case to be made to ease the restrictions for any category of healthcare just at the moment that's planned in that way.
Thank you. And we're hearing a lot from those who have family members in long-term care homes. Have any options been assessed for introducing visits to these homes prior to reaching level 1 or past the vaccine?
So when we're looking at visits to long-term care facilities, as you know, and as we've seen elsewhere in the country, these facilities are areas of concern for outbreaks and contain some of our the most vulnerable members of our population. So we need to make sure that we keep these facilities safe as we can. That being said, we know that visitation is an important part of the mental health and well-being of the people who live in these facilities. So that's something that we're always looking at. It certainly is us looking at our own epidemiology, the epidemiology elsewhere, what's happening with regard to cases as we move through this alert level 4 now, and as people start to move around more and expand their bubbles. It certainly would be premature to relax the visitation that we have in place at this point, but we will certainly be assessing it as time goes on in terms of all those local factors as well as other things happening elsewhere.
Thank you. And I'm sure this question has been asked probably 2 months ago now at this rate, but I'm wondering where we stand with antibody testing, knowing the numbers we have here in the province, and knock on wood, how well we have been doing.
So you're talking about, serology testing?
Janice, over to you.
Are you talking about serology testing, Kellyanne?
I suppose all of it, any antibody testing, and the way we can look at our genealogy here.
So with regard to the antibodies, that's what we typically call serology testing. So it's a blood test to see if people who have been infected with the virus developed antibodies to it and would therefore be considered immune likely. And right now there's still, the science on the antibody testing is still not definitive. And we've seen other areas in the world use antibody testing with less than stellar results, and can often confuse the picture and not give us good information. So we're waiting for Health Canada to recommend certain tests and to give us, and the Public Health Agency of Canada to weigh in on some direction with how we can use that testing most effectively to give us the information that we need to help control the outbreak.
Thank you.
Our next questions are from Holly McKenzie, Suitor of the Canadian Press. Please go ahead.
I'm just looking for an update on how many requests have come in for an exemption to the travel ban, and if you can say how many have been denied.
The last information that I had, which was late last evening, was over 2,000, around 2,000 requests that had come in so far. I do have the breakdown of the of how many have been approved and denied. However, I don't have it with me right now, but we can certainly get that to you.
Okay, thanks. And I'm wondering if you have a sense of kind of the general, what the most common, I guess, reasons would be, and I guess how the work is going now that there's kind of clear guidelines of what might be acceptable.
Yeah, the most common reason for people wanting an exemption is relocation. So people who've gotten a job here or are retiring or have finished school and this is their usual place of residence and moving home. So relocation is the number one reason, and then compassionate grants, coming home to provide care to a loved one, either because of disability or near end of life.
I will say, too, that the officials at Public Health has been doing a really good job in turning those applications and those requests around. But as I mentioned in my remarks today, you can now actually fill out those forms online. And so it will make it much easier then for the flow of information for those that are applying for exemption orders.
Great, thank you. And last question about the Curl Lake outbreak that was brought up last week. I'm wondering how many people in Newfoundland and Labrador have been tested since Dr. Fitzgerald advised them to reach out last week.
So as of the latest numbers that I have, I think was 30 or to 35 had been tested. And as we said last week, one person related to Curl Lake had tested positive, but that's the only one that has tested positive so far.
Our next questions are from Elizabeth Witt of All Newfoundland Labrador. Please go ahead.
PC official opposition finance critic Tony Wakeham sent out a list of immediate actions he'd like to see the government adopt in order to support local businesses, and it includes, a buy local campaign, rent relief, and e-commerce programs. Does the government plan to adopt any of these measures?
Well, the rent relief program is one that we talked about. This is a cost-shared program, so this is already one that we're willing to participate in. And so there's a whole host of things right now that we're analyzing, doing research on how we could actually support our business community. Some of those are regulation changes that we can actually do to support them actually as they move through. So there's a bunch of things that we're currently looking at now. We need to get those things, of course, costed up to some degree as well. So one thing we do know is that we will be there to support our business community, working with the federal government as well. So, what we're trying to do is make sure that we complement the federal government announcements, and then we complement that with some measures here in the province as well. And that's the reason why we put together a team to go out and do some consulting with our local businesses to make sure that we meet their demands and that what we can do that specifically help them. That's where the best information is, and that's why this level of engagement with the business community is so important.
Thank you. And recently, 8 million masks were rejected by the federal government because they didn't meet standards. Were any of these masks meant for the province? And do you know how many PPE have been rejected by the province because they don't meet a certain criteria?
It's hard to say exactly which of those would have been intended for Newfoundland and Labrador. If it was through the federal program, we get a pro rata share of what comes in. So I can go back and check on that. What I do know from our own purchasing experience directly as well as through the federal government is by and large, we actually never get to inspect the product more often than not. and the deal falls apart at that stage when our agents abroad either can't get access to the factory to inspect the product or are denied entry to the aircraft to inspect the product. Under those circumstances, the deal falls through, and that's happened at least 3 times that I'm aware of.
So right now, what we have at the national level, which is a big part of our discussion that the minister just mentioned, is a level of PPE. And for any province to properly reopen, as been mentioned, or us to move from an alert level 4 to 3, we must make sure that we got the appropriate level of PPE. So the federal government has put it, or they're monitoring this very closely. They have it in really 2 different sections where there's 6 items that are very closely being monitored. And your example of N95s, surgical mask, gowns, gloves, ventilators, and so on are just some of the examples that will be what we deemed, obviously essential to have. And there's some other things, another 10 items that are being monitored. So what they've been doing now is following up very closely with the provinces. As the minister said so many times, we place an order. We very rarely get anywhere close to what the order would have been, but so far we've been able to maintain a level of service no different than any other province across our country. So PPE is essential to actually, as all provinces and the business starts to reopen up for the new economy.
Thank you. And 244 people have now recovered from COVID-19. Have there been any notable concerning health complications that have been seen in other jurisdictions?
To date, no, I haven't been made aware of any. That is something that we will be looking at sort of going forward to see if there were any long-term consequences. That research will be done.
Thank you. We're now going to take one quick question from each reporter, starting with Ben Murphy of VOCM News. Please go ahead.
Dr. Fitzgerald, in Nova Scotia, many sports fields like ball diamond, soccer fields are partially allowed to open, not for team events or anything like that, but you can go kick around a ball or toss a ball around. That's not the case here as far as I know, and why not allow this small type of activity?
Because we want to reduce the possibility of people interacting with each other outside of their own bubbles, and the more you open up these sorts of things, the more chances you have of that happening. So we are taking things slow. We have opened up, many of the municipalities now have opened up their parks, and we have asked that outdoor spaces like parks be allowed to be open so that people can get out and enjoy some activities within their own bubble. We'll be monitoring things. We'll see how things go. And, as I've said before, this is not hard and fast. If we see that, if we see how things are progressing and we look at our own local epidemiology, we feel that certain things can change, then that can happen. But for right now, we have to take things slowly and we have to see what the effects of those changes will be. So I know it's really hard, and as the weather gets better, people are going to want to get out, but I do ask for people's patience and we will get there.
Okay, great. Thank you.
Next, we'll hear from Peter Jackson of The Telegram. Please go ahead.
Hi. I asked this on Friday, but I wanted to get an answer from Dr. Fitzgerald, and that is in-home regulated daycare. People who are providing daycare in their home, they're bringing children into that will inevitably intermingle with their own children. They can't get health officers or anyone else to inspect anymore as they're required. How are they supposed to stay safe?
So are these unregistered day homes? Was that?
No, regulated family child care homes.
Okay. Are you asking if they're able to have someone come in and
well, from my understanding, they're not. So I'm wondering how they're supposed to make sure that they're doing the right thing, even though they have children from a bunch of different people coming to their home.
So we've engaged with the Department of Education and Early Childhood Development, and we have certainly given advice about childcare facilities, and that would include regulated day homes. So there has been advice given, and all that same advice would apply with regard to making sure you keep things clean, don't have to screen the children before coming in. If the child is sick, obviously they shouldn't be attending the daycare. If there's family members that are sick, the child should probably not be attending the daycare as well. So there are those same screening measures that are in place for any daycare that would apply in those situations.
Yeah, Peter, given these were very different situations back a few weeks ago when we made provision to support families and essential workers for, which would be government funded and paid for by the government to the families for daycare. So it was left up to the families at that point, either regulated or non-regulated, to for them to make a decision where they could, which would be the safest way to provide that daycare. Many families have made a decision to actually work with a family member as opposed to going into even a regulated or shared childcare spaces. So right now we've worked very closely with the families to make sure that they could have their children safe, as the Chief Medical Officer has just mentioned, in regulated centers, but give them the option to work with their close family members as well, which was, as we said earlier, the preferred option.
The next question is from Peter Cowan of CBC News. Please go ahead.
As private healthcare clinics look to open, we've got some businesses opening. What's the province doing to try and help them source PPE, considering it's been a struggle for even the province to get it, let alone, for example, like a family doctor's office?
We have worked very closely with the NLMA and the RHAs, Peter, to make sure that any family physician who wants PPE has a source and a location where they can go and get that. We have, whilst you're talking about private offices opening up, there has never been a bar to primary care practices seeing urgencies or emergencies. We have some evidence that has continued from older billing data for sure. So the challenge from our point of view is around PPE in general. And as the Premier referenced, it's always light and it's always late. So we have our own internal RHA sources, and we broaden that to include personal care homes and primary care providers. We've got a provincial, a national approach with the federal government, but we're also working with local manufacturing to see if we can gain some degree of local supply. None of those has been a magic bullet yet, but again, if practices feel they need to have that discussion, there are routes through which they can do that in advance of opening.
And as been said so many times, anytime you make a decision when you work with public health officials, is the risk assessment that would incur if you had to make a decision on the impact of overall availability of PPE. And that is part of that risk assessment. As you make a decision whether any service would open up, what would the demand be and the capacity of PPE for the province?
Our next question is from Marie Isabelle Rochon of Radio Canada. Please go ahead.
So I'm wondering, as of today, so how many people are currently in self-isolation? So how many of those people are healthcare workers? I'm not looking for the total number since the beginning of the pandemic. I'm asking for the total number as of today.
There are 217 staff in RHA self-isolating as of this morning at 9 o'clock.
Thank you.
Our next question is from Kellyanne Roberts of NTV News. Please go ahead.
Wondering if private camping parks are having any compensation with the fact that they can't do overnight parking till level 2.
So from a federal government point of view, for those that are incorporated, there is support there. They can get a loan of up to some $40,000, and if that is paid back under, I think it's in 2 years, 10,000 of that would be forgiven. So there are a number of options with any business that's incorporated, within the country, to able to access some of the federal funding to support those. The liquidity and maintaining a cash flow, we know is extremely important, but we also know the impact on public health if we get an outbreak as a result of private camping. We know this is important for Newfoundlanders and Labradorians as we head into the May 2-4 weekend, but, it's a decision to protect, the overall general public health of the province. And it's unfortunate, but this is where we are, and these are the decisions that we have to make during this pandemic.
Thank you.
Our next question is from Holly Mackenzie-Suter of the Canadian Press. Please go ahead.
Looking for, I guess, what you're watching for in terms of kind of possible areas of concern during level 4 that may not have already been addressed in briefings and stuff like that.
So we will be looking at not just the number of cases, but what the trends are in the number of cases. So are we seeing a sporadic case here or there? Or are we seeing a gradual increase in the number of cases day by day? We'll be looking at things like hospitalizations, and we'll be looking at ICU bed capacity, what our public health capacity is, and how well public health is responding to cases and contacts. And up to now that work has been stellar. There are a lot of individual indicators that we will be looking at to help us determine how we can and if we can move ahead. None of them are taken on their own. They're all taken in consideration of each other and in the context of our local epidemiology and what's happening elsewhere in the world.
Our final question is from Elizabeth Whitten of All Newfoundland Labrador. Operator, if you could extend this call just past this answer so that we can get the full answer on the call today. Thank you. Please go ahead, Elizabeth.
If you're using a speakerphone, please lift up the handset or unmute your line before pressing star 1.
If there are no further questions, the time for questions has ended. Please join us again tomorrow at 2 p.m., 1:30 in most of Labrador. Have a great evening.